feel invisible. They're not seen or heard, or people don't respond immediately to the call. So you see a large increase of urban policing among Black youth, and you're not seeing the fact that people look at them as small children that needs protection and need to feel supported and safe. And so I've seen this happen, not to that extreme, but I've seen it happen where, Black girls are placed in certain foster homes and they're telling their caseworker, they're telling their, CASA worker, the law guardian that, I don't like where I'm being placed. I don't feel safe here, or I'm being bullied at school. And it's always, you just have to wait till your next court date. You have to stay here. You can't go back home just yet. And so Black girls are not really viewed the same way as white girls that are placed in foster care.
So if Marlene, if the research shows that kids fare better when they stay with family, kinship care, why does the system continue to focus on fostering, placing kids outside of their family, environment?
I think a lot of it has to do with the fact that when you have to be placed in a kinship care, there's a lot of work that goes into it with making sure the home has been assessed by a child protective CPS worker, child protective service worker, where they're going in the home, they're doing background checks on everyone that's in the home. There's a lot of paperwork that goes into it. And so if you already have a resource parent, also known as a foster parent, who's available, whose home has been licensed and cleared, then oftentimes you'll find that they'll just place a child in that home. So if you get a call at 11 p.m. on a Friday evening, you're on call as a child protective service worker, and you have to remove that child out of the home, then you're calling the judge to get an immediate removal. And you're going to place them with one of your resource parents that you have, maybe for the weekend, until you decide where that child needs to be placed. But then people aren't getting to that part. And what I find is that also too, a child is not just removed out of the home immediately. They may have been multiple calls previously, but also too, they aren't providing services in the home to support that child in their home environment. So whether it's providing in-home therapy, to having that child assess and providing additional support in school for them if they're struggling with their emotions or their behaviors. So they're not providing that additional support and trying to figure out, okay, what family members do we have that we can build connection with? Because studies do show that when there is kinship care, it's easier for that child with that transition. When they have those home visits or when they have supervised visitations, now you're there with your biological parents, you're there with your caregivers, you're there with the kinship worker, the kinship parent, the parent that you have that's taking care of you at the moment, and they all may know each other. It's easier for that child. But when you're placing a child in a foster care where it's not with a family member, it's not with a relative, and imagine what that transition looks like when they have to have supervised visitation. There may be some tension in the room. This isn't, you aren't my mother, you aren't my father, you're not related to me. I want to stay with my family. And I think that's something else that we don't explore often, is that when children go for these home visitation, whether it's for the weekend, whether they're supervised or unsupervised, child protective service workers also have to prep the resource parents as far as, are there going to be any changes with their behaviors and moods when they return back into your home? Because they're not staying with their biological family overnight, or they're not returning back home and they have to go back with that resource parent. Really helping them with that transition, letting the schools know about that transition too, that where if there's any behaviors that you recognize, for you to not immediately push those children and criminalize them and push them into whether it's a school to prison pipeline, whether it's moving that child from a resource home and putting them in a therapeutic foster care home, or putting them in a residential facility or group home or psychiatric hospital, because this often happens too, where people are placing them to a higher level of care.
We talked a lot about the adultification. Regina started, the interview earlier in the show talking about being seen as an adult, not being seen as a girl. We know that Georgetown 2017 study is out there about the adultification of Black girls. We saw the mayor in the case of Makia come out and refer to her as a young woman or a young lady. that whole fight that she was involved in, being characterized again as adults fighting, not as kids having, a kid squabble. Yes, she did have a knife, can't, deny that fact, but still the whole situation just, reminds us of how often Black girls in particular are characterized in a way that can lead to them being treated as adults, whether it's punishment or, in this case, just regrettably, being shot by police. What do you see that's being done, if anything, to address, the studies out there, the research is out there? We know this issue all too well now, but do you see any changes being made in the foster care system to address what we know to be the case?
To be quite honest, I don't see a lot of changes. I see a lot of talk about here are the recommendations, what we need to have. We need recommendations with, culturally responsive child protective service workers. We need less school resource officers in the schools. We need, more mental health services for African-American youth. So I see a lot of these recommendations, but what I'm not seeing is policy being changed to address those needs. So we know that 81% of social workers are women and that 58% are white social workers. So we also have to address what does the racial biases look like of white social workers that are working with Black and brown children? How do they view them? Do they view them like adult-like figures or do they see them as children? How are their documentations and notes when they're doing their documentation about youth that are in the foster care system? Are they criminalizing them? Are they writing their notes in a way where it makes that child have less access to certain resources and pushing them into alternative and therapeutic settings and not really giving them a second chance to be home with their family? I also think that we need to have more culturally responsive trainings for mental health professionals and those that are working for child protective services. We know they have annual trainings that they do, but we need more trainings on how do you work with Black girls? What does adultification biases look like? How does trauma look different in Black girls compared to white girls? And also too, we know the CDC put out a report that, the death by suicide rate has been going up for Black youth compared to other racial and ethnic groups. So how does that really impact those that are coming into the foster care system, especially when we know that foster care youth are more likely to have symptoms of ADHD? So how are we addressing their mental health needs? Because that's the part that I think is missing, is the psychological well-being of children that are being placed in foster care settings. They need to be placed with family. So if there is a call that's being called out, child protective services need to start gathering names of those that are family members that the child can stay with. And how can we streamline that process so it's not taking a month or 2 months to find them a place to stay. And now they're being placed in a resource parent home, a foster parent's home that may be 45 miles away from their home. And now their family does not have public transportation or access to go see them. Now that child is displaced from not only their natural environment, they're in a new school environment where they have to learn new people. And so we have to just not only thinking about, the environments that they're placed in, but how does that impact their positive youth outcomes?
Yeah. And you heard Sandra talk about the Biden administration being focused on foster care issues and addressing the crisis in the system. What do you want to see happen? I mean, this is National Foster Care Awareness Month. We're shedding a light on the issues in the system. We're celebrating those folks who are doing good work in the system. Regina says abolish the system. She says, as it currently exists, it is not set up to support African-American kids in particular. From your perspective, having worked inside the system for many years, what do you see the number one change? What would you like to see as the number one change that could really address some of these critical issues we've been talking about?
The number one thing I want to see change is putting Black girls at the table. Give them a seat at the table. They know better than anyone else what they need. So girls like Ma'Khia Bryant, for them to share their lived experiences so they can tell you exactly what's going on. They know the grit of it all, because we're often hearing the perspectives of policy workers, researchers and scholars and psychologists. We're hearing from experts, but the true experts of all of this are the girls that are in the system. So we need to give them a seat at the table. They can tell us how we can better advocate for them, what type of services that they need, how we can truly make things equitable for them, because we keep hearing these talks about equity and social determinants of health, but we don't have young girls at the table. We have too many experts, and someone needs to get their seat up off that table. And we don't have enough experts that are brown and Black people. That's the other thing too. So we need more brown and Black experts that have a seat at the table, but we need to put some Black girls at that table so they can tell us what exactly is it that they need, so we can truly dismantle the system, because right now it's not working. It's not benefiting brown and Black children. They're less likely to get adopted out of the system. They age out of the system, and what ends up happening? Some of them may end up homeless. Some of them may end up in the criminal justice system.